So the other thing that has changed is consumerism. You know, this idea that you get to shop, you get to choose what you buy and why you buy it and when you buy it. Well, that's new for healthcare. We've talked about it for a long time, but today's consumer is demanding more. Again, they love their doctor. My patients love me. But guess what? They don't like my patient portal. They don't like the fact that the data never follows them. And frankly, I don't think they like our office manager. So this is a top priority, right? 90% of healthcare provider executives say consumerism is a top priority. Why? Because consumers have a choice for the first time, and they will switch even though they trust their doctor. 69% of Americans would switch to a provider with more appealing services. That kind of hurts my feelings, right? But it's the truth. Because if you have to wait an hour and a half, 2 hours in my waiting room, you got stuff to do. So how do we as healthcare get better? How do we remember that the consumer experience matters? So consumerism, because of the age we're living in, has given rise to some, what I call the new kids on the block in healthcare. You guys like New Kids on the Block, you remember that, right? It's pretty decent music. So who are some of the new entrants in healthcare because of this rise of consumerism? Retailers, big tech. You've seen them in your markets, right? CVS, Walgreens. Walmart says that 90% of Americans live within 10 miles of a Walmart. It's pretty significant and much bigger of a footprint than any hospital can imagine, right? Big tech. Big tech was supposed to save healthcare. Anyone remember the Amazon, Berkshire Hathaway, Haven project? What happened to that? Healthcare still hasn't been saved, right? Anyone remember Microsoft Health Vault? Launched, failed within 3 years. IBM Watson. IBM Watson was supposed to cure cancer. Didn't happen. The biggest gap with big retailers and big tech, they have tremendous pockets. They have tremendous, tremendous resources to throw at the problems we all know and understand. They have ample knowledge when it comes to consumer experience. But what they don't have is the knowledge you all have. They don't know healthcare, and they don't know the communities that you serve. So while they are interesting allies and interesting competitors, one of the things I want you to think about is what is their role and how can you partner creatively? But to be clear, they will not save your communities. Only you are going to save your communities. Telemedicine. Look, for the first time, one of the biggest trends is that telemedicine has taken off. Again, been around a long time, just like AI, but for the first time, telemedicine has become a reality, and we have more options than email and a good old-fashioned phone call, right? We've come a long way, and we should lean into that, particularly in rural communities where access remains an issue. AI. Has anyone heard of AI? ChatGPT? This thing has gone viral. Again, technology is going to save healthcare. I don't think so. You are going to save healthcare. What technology can do, what AI can do is incredible. It is incredible, and we are going to see many things change for the better. But we also might see some things change not for the good, not for the better. So the most important thing to remember about AI is that it will compound and be a force multiplier for both our good habits in healthcare and our bad habits, and our biases as we think about health equity and the rural communities that you serve. So we must be very intentional as AI goes mainstream.